Lemons have long been seen as a symbol of good health and cleansing. They are commonly added to water, tea, salads, and even to weight loss products. However, behind this widespread citrus obsession, there are some troubling facts that are rarely discussed. In this video, you will find out what might be wrong with lemons and why consuming them every day can lead to serious health issues, especially if you do not practice moderation. This video is going to be incredibly informative and helpful. If you want to take control of your health like a pro, give it a like, and let's get started. 1. Increased risk of kidney stones from excessive vitamin C intake. According to the United States National Institute of Diabetes and Digestive and Kidney Diseases, the number of people diagnosed with kidney stones has increased by 40% over the past 10 years. What is especially concerning is the rise in cases among individuals between the ages of 40 and 60, those who actively monitor their health and consume trendy, natural supplements and detox products. One of the most popular ingredients in these products is lemon. Rich in vitamin C, lemon has become a regular part of many people's diets. It is added to water, tea, and salads, and in some cases, people even drink pure lemon juice on an empty stomach. However, this seemingly harmless routine can pose a hidden risk. A study published in the American Journal of Clinical Nutrition found that consuming more than 2,000 milligrams of vitamin C per day increases the risk of forming oxalate crystals in the kidneys by 31%. The body converts excess vitamin C into oxalic acid, which can bind with calcium and form stones in the urinary tract. Considering that a single medium-sized lemon contains about 50 milligrams of vitamin C, it is easy to see how drinking lemon water, tea with lemon, and eating salads with lemon daily can unintentionally lead to exceeding the safe limit, especially for those who also take vitamin supplements. A real-life example illustrates this risk. Bill, a 54-year-old resident of Portland, Oregon, spent 3 months starting every morning with lemon water, adding lemon juice to his lunchtime salad, and ending the day with tea and lemon. He did not take any medications, felt healthy, and believed that lemons were helping cleanse his body. But one day, he experienced a sudden, sharp pain in his lower back and went to the emergency department. At Providence Health and Services, urologist Dr. Kevin Rice diagnosed him with a 5-millimeter oxalate stone in his left kidney. Bill required medical treatment and had to follow a strict diet that excluded citrus fruits. If you want to support kidney health, it is important to consume lemons in moderation. For adults, the safe upper limit for vitamin C intake is 2,000 milligrams per day. If you regularly drink lemon water or tea with lemon, avoid adding vitamin supplements to your routine without consulting a doctor. This is especially important for individuals with a known tendency to form stones. A better approach is to alternate lemons with other sources of vitamin C, such as broccoli, strawberries, or bell peppers, and to drink plenty of plain water that is not acid-enriched. 2. Thyroid suppression in cases of iodine deficiency. Thyroid issues have become one of the most common endocrine disorders in the United States. According to the National Institute of Diabetes and Digestive and Kidney Diseases, about 20 million Americans suffer from various thyroid dysfunctions. The problem is especially pronounced in regions where the soil and water naturally lack iodine, such as the Midwestern states of Michigan, Wisconsin, Minnesota, and Ohio. In these areas, statistics show that 1 in 3 women over the age of 40 experiences symptoms of hypothyroidism, including fatigue, weight gain, low energy, and mood swings. At the same time, the popularity of lemon water and daily citrus consumption has rapidly grown. However, few people realize that lemons contain a flavonoid called naringin. A study published in Thyroid Research by scientists at the University of Pennsylvania found that naringin can suppress the activity of iodine-transporting proteins in thyroid cells. This effect is especially concerning in conditions of chronic iodine deficiency. When citrus fruits, including lemons, are consumed in large amounts on a regular basis, the body's ability to absorb iodine from food can be significantly reduced. As a result, the thyroid gland may not receive the iodine it needs to function properly. A case from medical practice highlights this issue. A 48-year-old woman named Alice came to St. Luke's Hospital in Duluth, Minnesota, with complaints of constant fatigue, chills, and difficulty losing weight despite regular fitness training and a healthy diet. During examination, doctors found that she had low levels of thyroid hormones and a slight enlargement of the thyroid gland. Endocrinologist Dr. Joanne Miller paid special attention to the fact that Alice drank up to 3 glasses of lemon water daily. After she stopped this habit and added iodine-rich foods such as seaweed, eggs, and seafood to her diet, her condition noticeably improved within about 6 weeks. If you live in an area with iodine deficiency or are at risk for thyroid disorders, especially if you are a woman over the age of 40, it is best to avoid consuming large quantities of lemons regularly. 1 or 2 slices in tea or water a few times a week is generally safe, but drinking large amounts of lemon juice every day can make iodine deficiency worse. Support your thyroid with foods naturally rich in iodine, such as seaweed, eggs, shrimp, and cod. And always consult your endocrinologist before making significant dietary changes, especially if you are experiencing symptoms of hypothyroidism. 3. Bladder irritation from regular consumption of lemon juice. According to the National Institute of Diabetes and Digestive and Kidney Diseases, approximately 25 million people in the United States experience symptoms related to bladder dysfunction each year. These issues, such as frequent urges to urinate, discomfort, burning sensations, and urinary incontinence, are especially common among women over the age of 40. Among the factors that can worsen these symptoms, diet plays a major role, particularly the consumption of acidic beverages, including those made with lemon. Although lemon water is widely promoted as a healthy cleansing drink, very few people realize that its high content of citric acid can significantly irritate the lining of the bladder. This is especially concerning for individuals who already have increased sensitivity in the urogenital system. A study conducted at the Mayo Clinic and published in the journal Urology Health found that in women with painful bladder syndrome, drinking citrus-based beverages, including lemon water, increases the risk of symptom flare-ups by 2.5 times. Citric acid can disrupt the pH balance of urine, intensifying irritation and creating conditions for inflammation. A real-life case from modern medical practice confirms these findings. A 41-year-old woman named Laura visited the urology department at Sharp Coronado Hospital in San Diego. In an effort to improve her well-being and lose weight, she had started drinking lemon water 3 times a day. By the 5th day, she began to experience frequent urges to urinate, a burning sensation, and a dull ache in her lower abdomen. Urologist Dr. Matthew Collins conducted an examination and diagnosed her with acute, uncomplicated cystitis. During the consultation, it became clear that the only major change in Laura's routine had been her new habit of drinking lemon water regularly. Once she stopped consuming acidic beverages and began treatment, her symptoms subsided within 4 days. If you experience bladder discomfort, especially if you are prone to cystitis or have a sensitivity to acidic foods and drinks, it is best to avoid frequent consumption of lemon juice. Even in healthy individuals, excessive acidity can cause irritation. A safe approach is to add 1 or 2 thin slices of lemon to water no more than once per day. At the first signs of discomfort, all acidic drinks should be eliminated, and you should consult a urologist. It is also important to drink enough plain water without additives to help maintain a healthy urinary system. 4. Irritation and worsening of gastritis, increased heartburn, and acid reflux. In the United States, the number of people suffering from stomach and esophageal disorders continues to rise every year. According to recent statistics from the National Institute of Diabetes and Digestive and Kidney Diseases, around 60 million Americans regularly experience symptoms of heartburn, acid reflux, or gastritis. As various detox programs gain popularity and lemon water consistently ranks as one of the top cleansing remedies, there has been a paradoxical increase in complaints among those who turn to acidic drinks in an effort to cleanse the body. Lemon is often labeled as an alkaline food, but that is only in theory. In practice, when lemon juice reaches the stomach, it stimulates the production of hydrochloric acid. For someone with a healthy digestive system, this may go unnoticed, but for individuals with a weakened stomach lining, due to hidden gastritis, inflammation, or the use of medications that irritate the stomach, lemon can act as a trigger, provoking flare-ups. A study published in the American journal Alimentary Pharmacology and Therapeutics showed that regularly consuming acidic foods, including lemons, increases the risk of developing gastroesophageal reflux disease by 38%. This risk is particularly high in people who drink lemon water on an empty stomach, add lemon juice to tea before bed, or use lemon-based salad dressings daily. A real-life case illustrates this point. Catherine, a 51-year-old accountant from Austin, Texas, was inspired by a detox article and began drinking warm lemon water every morning without missing a day. After about a month, she began experiencing dull stomach pain, nausea after meals, and a feeling of heaviness. At Baylor Scott and White Medical Center, doctors diagnosed her with focal gastritis. Before this, Catherine had never experienced any digestive issues. Gastroenterologist Dr. Jason Holliday pointed out a direct link between the irritating effects of citric acid and the inflammation of the stomach lining. Another case involved Greg, a 44-year-old from Los Angeles, who had developed the habit of adding lemon juice to his tea each night and thinking it was a calming bedtime ritual. After a few weeks, he began feeling a burning sensation in his chest, especially when lying down. At Cedars-Sinai Medical Center, after undergoing an endoscopy, he was diagnosed with grade 2 esophagitis, an inflammation of the esophagus caused by the repeated backflow of acid from the stomach. If you have ever experienced heartburn, gastritis, stomach discomfort, or even just sensitivity to acidic foods, it is best to avoid drinking lemon water on an empty stomach. Do not add lemon to tea in the evening or right before bed. Using a few drops of lemon on food that has already been eaten is generally considered safe, but lemon juice should not be used as a primary beverage. To support digestive health, choose neutral foods such as oatmeal, chamomile tea, or room temperature water. If you have ongoing symptoms, it is important to consult a gastroenterologist and avoid experimenting with acidic products on your own. 5. Accelerated loss of calcium from bones due to frequent lemon consumption. According to recent data from the United States National Institute of Arthritis and Musculoskeletal and Skin Diseases, more than 10 million Americans are affected by osteoporosis, and approximately 44 million more are living with osteopenia, a condition that signals the early stages of bone weakening. Older women over the age of 50 are especially vulnerable due to declining estrogen levels and disrupted calcium metabolism. However, few people realize that one of the hidden factors contributing to the accelerated loss of calcium may be the frequent consumption of acidic foods, particularly lemons. Citric acid has a strong influence on the body's acid-base balance and kidney function. When consumed in large amounts on a regular basis, especially in the form of concentrated lemon juice or lemon water taken 3 times a day, the body begins to compensate for the acid load by excreting calcium ions through the urine. This process is especially harmful for individuals who already have reduced bone mineral density. A study published in the Journal of Clinical Endocrinology and Metabolism by researchers from the University of North Carolina School of Medicine found that long-term consumption of foods high in citric acid leads to increased calcium levels in the urine and accelerated bone mineral loss. The most significant effects were observed in the lumbar spine and hip region. Women over the age of 60 with deficiencies in vitamin D and magnesium, 2 key nutrients that help retain calcium in bones, are at the greatest risk. A real-life case from medical practice illustrates this point. Helen, a 64-year-old retiree from New York City, decided to follow a trendy citrus detox routine. For 6 consecutive months, she drank 3 glasses of lemon water every day, 1 in the morning on an empty stomach, another with lunch, and a third after her evening walk. Although her overall diet was balanced, she had eliminated dairy products and did not take any calcium supplements. As a result, her body began rapidly losing mineral reserves. During a routine checkup at Mount Sinai, a bone density scan revealed a 7% reduction in her bone mass. Endocrinologist Dr. Lucas Pearson identified a clear link between the high acid load from daily lemon consumption and increased calcium loss through the kidneys. Helen had to make significant changes to her diet and begin taking calcium and vitamin D as prescribed. If you are over the age of 45, especially if you are a woman concerned about bone health, avoid drinking large amounts of lemon juice every day. A safe amount is considered to be 1 glass of water with just a few drops of lemon per day. It is also important to monitor your calcium intake. Women over 50 need about 1,200 milligrams of calcium daily. This can come from food sources like broccoli, almonds, sardines, sesame seeds, and leafy greens, or from high-quality supplements when needed. Maintaining proper levels of vitamin D is also essential, as it helps the body absorb calcium, particularly during the winter months when sun exposure is limited. Most importantly, avoid following trendy detox programs without first consulting your doctor. 6. Potential harm to blood vessels from frequent lemon consumption in people with vascular fragility. According to recent data from the National Heart, Lung, and Blood Institute, more than 65 million people in the United States suffer from cardiovascular diseases, and nearly half of them have been diagnosed with chronically elevated blood pressure. Women over the age of 60 are especially vulnerable, as vascular wall elasticity tends to decrease with age. The paradox is that this same group is often the most likely to drink lemon water as a natural remedy for vascular health, unaware that in some cases it may have the opposite effect. Lemons do contain flavonoids, such as hesperidin and diosmin, which are widely used in pharmaceuticals to strengthen the vascular wall. However, the key factor is dosage and the body's individual vascular response. A study conducted by the Johns Hopkins University School of Medicine, published in the Journal of Vascular Health, found that frequent and uncontrolled consumption of lemon water in people with hypertension and varicose veins may lead to overstimulation of vascular tone. This can result in localized or systemic spasms, blood pressure fluctuations, headaches, and even temporary numbness in the limbs. In practice, this means that instead of providing gentle vascular support, lemon may cause sudden constriction of blood vessels, especially in the peripheral parts of the circulatory system, in the hands, feet, and lower legs. These spasms can trigger headaches, tingling, numbness, and blood pressure spikes in people with impaired vascular regulation. A real-life medical case demonstrates this risk. Margaret, a 67-year-old resident of Santa Fe, New Mexico, began each morning by drinking 2 glasses of warm water mixed with the juice of half a lemon. After just 1 week, she visited Presbyterian Santa Fe Medical Center with complaints of throbbing pain in the back of her head and numbness in her fingers. Vascular testing revealed peripheral spasms and unstable blood pressure. Cardiologist Dr. Jonathan Reeves reviewed her dietary habits and concluded that her symptoms were caused by excessive citric acid intake, which was affecting the vascular walls. After removing lemons from her diet and adjusting her nutrition, her symptoms disappeared. If you have been diagnosed with high blood pressure, varicose veins, migraines, or if you are over the age of 60, it is best not to drink lemon water every day. Drinking it once every 2 or 3 days is a safer and more balanced approach. Also, avoid combining lemon with vasodilator medications or supplements containing the same flavonoids. It is important to monitor your blood pressure in the morning and evening, especially if you already have vascular issues. To support vascular health, consider alternating lemon with other sources of vitamin C that are gentler on the circulatory system, such as kiwi, broccoli, sea buckthorn, or rosehip tea. And most importantly, do not treat lemon as a universal remedy. If you notice any changes in how you feel, consult a physician. 7. Tooth enamel damage, gum irritation, and oral tissue sensitivity from citric acid in lemons. According to the American Academy of Dental Medicine, more than 70% of adults in the United States experience increased tooth sensitivity. Surprisingly, one of the main causes is not sugar, but acidity, specifically the frequent consumption of lemon juice, including lemon water, especially when consumed in the morning. Lemon juice has a pH level of around 2, which is similar to that of vinegar and stomach acid. This means that when it is consumed regularly, it can have an aggressive effect on tooth enamel, the hard but delicate protective layer of the teeth. Enamel does not erode instantly. At first, people may notice sensitivity to hot tea or cold water. Over time, microcracks appear, the teeth lose their shine, become darker, and start to feel rough. This process is called demineralization, and unfortunately, it is irreversible. A study conducted by Tulane University School of Dentistry and published in the Journal of Dental Research confirmed that regularly consuming acidic drinks with a pH lower than 4.5, especially on an empty stomach, leads to persistent mineral loss in the enamel layer within 6 months. The issue is not limited to the teeth. Lemon juice can also irritate the gums and the mucous membrane inside the mouth, particularly in older adults whose oral tissues are thinner and slower to heal. A real-life example illustrates the risk. Jennifer, a 43-year-old accountant from Chicago, had been starting her mornings with warm water and the juice of half a lemon every day for a year. believing it would help cleanse her body. Gradually, she began feeling discomfort while brushing her teeth. Cold water triggered sharp pain, and her teeth began to darken despite regular oral hygiene. At the University of Illinois College of Dentistry, her dentist diagnosed moderate enamel erosion. The surface of her teeth had become porous, and the process of dentin breakdown had already begun. She required comprehensive treatment, including fluoride applications and the use of protective coatings. If you want to avoid enamel erosion and painful tooth sensitivity, never drink lemon water on an empty stomach, especially not in concentrated form. If you do consume lemon, always dilute the juice in a large volume of water and drink it through a straw to prevent contact with the teeth. Afterward, rinse your mouth with plain water, but do not brush your teeth immediately. Acid softens enamel, and brushing too soon can cause additional damage. Make sure your diet contains enough calcium and vitamin D to strengthen your enamel from within. And if you notice any early signs of sensitivity or irritation, see a dentist before the problem worsens. 8. The false sense of detox and appetite suppression leading to wasting in older adults. Every year, the number of detox products on the US market continues to grow. These items promise miraculous body cleansing, weight loss, improved well-being, and even longer life. One of the most popular practices among them is drinking a glass of lemon water on an empty stomach. This habit is widely promoted on social media, in blogs, and even in some fitness programs. However, both medical statistics and real-world clinical experience tell a different story. According to the National Institute on Aging, nearly 27% of Americans over the age of 65 are either underweight or at risk of malnutrition. Many older adults, especially those living alone, already experience reduced appetite due to age-related changes in taste, weakened digestion, or the side effects of medications. In these cases, any additional appetite suppression can lead to loss of muscle mass, fatigue, and a condition known as sarcopenia, age-related physical wasting. Surprisingly, lemons can contribute to this problem. A study by the Johns Hopkins Bloomberg School of Public Health found that consuming acidic beverages before meals reduces the production of ghrelin, the hunger hormone, resulting in a decreased calorie intake during subsequent meals. While this effect may be useful for younger, active individuals, it can be harmful for older adults. In practice, this often plays out as follows. A person skips breakfast or a healthy snack and replaces it with a glass of lemon water, believing they are helping their body detox. In reality, they are not eliminating toxins. They are missing out on essential nutrients. This is especially dangerous for people who are already underweight or who have chronic illnesses that require proper nutrition. One real case involved a 74-year-old man named Donald, who came to Mercy Medical Center in Baltimore after losing 6 kilograms over 2 months without an obvious reason. Concerned family members insisted he get checked. During a consultation with registered dietitian Dr. Andrea Slater, it was revealed that Donald had been drinking lemon water every morning and often curbing his appetite by skipping full breakfasts. He believed this routine was helping his liver cleanse itself. In fact, he was experiencing rapid muscle loss and his blood protein levels had dropped below normal. After reintroducing balanced meals and discontinuing acidic drinks on an empty stomach, his weight stabilized. If you are over the age of 60 and are focused on maintaining your health and longevity, do not rely on lemon water detox routines. The liver and kidneys are your body's natural filters. They do not need lemon to function properly. What truly matters is a well-rounded, nutritious diet. Use lemon not on an empty stomach and not as a meal replacement, but as part of your dishes, for example, in a salad dressing or to flavor fish. Monitor your body weight and avoid any rapid weight loss, even if it appears to be part of a cleansing process. Always consult a physician or registered dietitian before making major changes to your diet, especially in older age. 9. Negative effects on circulation, blood pressure, and cold sensitivity. According to the National Heart, Lung, and Blood Institute, 1 in 3 adults in the United States suffers from hypertension, high blood pressure. That adds up to more than 75 million people. Many of them take medications to regulate their blood pressure, including angiotensin-converting enzyme, ACE inhibitors. However, lemon water, which is often seen as a harmless and even beneficial morning drink, can unexpectedly intensify the effects of such medications and negatively impact circulation. A study published in the American Journal of Therapeutics found that certain compounds in citrus fruits, including lemons, may alter the metabolism and absorption of antihypertensive drugs in the liver. As a result, the body can respond more strongly than expected. For some people, this may lead to a sudden drop in blood pressure, especially in the early hours of the day. Symptoms can include dizziness, weakness, nausea, the feeling of the ground dropping out from under your feet, and in some cases, fainting. At the same time, lemon has a naturally cooling effect on the body. From the perspective of traditional medicine, it is considered a cooling food, and this classification is supported by scientific evidence. When lemon water is consumed regularly, especially during colder months, individuals with poor circulation may become more sensitive to low temperatures. Women with Raynaud's syndrome are especially affected. Their fingers and toes may turn pale, go numb, and become painful when exposed to cold. One real-life example comes from University of Colorado Hospital in Denver. A 56-year-old accountant named Maria had been taking lisinopril, an ACE inhibitor, and began drinking lemon water every morning and throughout the day. Within a week, she started experiencing sudden drops in blood pressure in the mornings, along with weakness and nausea. In addition, despite dressing warmly, she constantly felt cold, and her fingers turned pale even at temperatures around 10 degrees Celsius, 50 degrees Fahrenheit. Cardiologist Dr. Edward Lynch advised her to stop drinking lemon water and recommended switching to warm rosehip tea instead. Her symptoms improved within 4 days. If you are taking blood pressure medications, especially ACE inhibitors, do not combine them with regular lemon water consumption without first consulting your doctor. Avoid drinking lemon-based beverages on an empty stomach or overusing them during winter, particularly if you are prone to chills, cold sensitivity, or poor circulation in your hands and feet. For women with Raynaud's syndrome, it is best to eliminate acidic, cooling drinks altogether in colder months. Instead of lemon, opt for warm infusions made with ginger, rosehip, or chamomile, which gently support vascular tone without interfering with medication. And always check with your doctor before making any major changes to your diet, especially if you have a chronic health condition. 10. The effect of lemon water on medications. A subtle but serious reaction. In recent years, American pharmacologists have increasingly focused on what are known as drug interactions, cases where food or beverages unexpectedly alter the absorption or effectiveness of prescription medications. According to the National Institute of General Medical Sciences, around 60 million Americans take at least one prescription drug every day, and more than 20 million take 3 or more. Against this backdrop, drinking lemon water may seem harmless until it begins interacting with medications. The interaction starts in the liver. Our bodies rely on an enzyme called CYP3A4, which plays a critical role in breaking down and eliminating many medications. However, certain compounds found in lemons, especially furanocoumarins, can partially block this enzyme, much like grapefruit does. As a result, drugs that are normally broken down gradually may begin to build up in the bloodstream. This can increase the risk of side effects or lead to an overdose, even when the prescribed dosage remains unchanged. In some cases, the opposite effect may occur. When the medication fails to convert into its active form, its effectiveness is reduced. A study conducted by the Department of Pharmacology at the University of Michigan and published in the Journal of Clinical Pharmacology found that patients who drank lemon water while taking statins experienced a 1.5 to 2-fold increase in drug concentration in their blood. This was particularly noticeable with lovastatin and atorvastatin. A similar effect was observed in patients taking antidepressants, anti-anxiety medications, and antibiotics, all of which rely heavily on CYP3A4 for proper metabolism. A real-life case demonstrates the risks. James, a 58-year-old man from Houston, was undergoing treatment for an anxiety disorder. He had been prescribed escitalopram at a standard dose. Around the same time, he started drinking lemon water in the morning and evening, following the advice of a blogger who claimed lemon clears the mind and improves focus. Within a week, James began experiencing extreme drowsiness, headaches, and delayed reactions. At Houston Methodist Hospital, follow-up testing revealed that the level of escitalopram in his bloodstream was nearly twice the normal range. Psychiatrist Dr. Brian Curtis explained that the lemon water had slowed the drug's metabolism, intensifying its effects. If you're taking any medications, especially statins, antibiotics, antidepressants, or anti-anxiety drugs, do not drink lemon water at the same time as these treatments. If approved by your doctor, it is best to drink lemon water at least 2 to 3 hours before or after taking your medication. Always inform your healthcare provider about your dietary habits, even those that may seem healthy. What is safe for one person may be harmful for another during treatment. Always follow personalized medical advice and never change your routine without consulting a specialist. Next, I recommend checking out these videos, and don't forget to leave your likes and comments. I'm looking forward to them.